Today I want to talk about patients with vertebral compression fractures, how we diagnose it and how we can treat it. Here's an MRI of a 75-year-old patient that came to us having severe back pain after lifting something not too heavy, only about 10 pounds. He felt a pop. He wasn't able to ambulate anymore without a walker. He could barely get out of bed. So we got him in the office. We checked an x-ray. And as we look at this x-ray on this side, we see that he has some depressions in a few bones. So here at L1, we see this little deformity here. L2 a little bit, but not too bad. L3, some compression here. And L4, also a compression. With this, we don't really know the age of these fractures. They could be old fractures. He did say he possibly had some fractures in the past. He doesn't really remember. So what we need to do is get an MRI. That's the next step once we know someone has some kind of compression fractures with severe pain. We also gave this patient a TLSO brace. Why do we do that? Well, we don't want the fractures to get any worse, and it will stabilize them a little bit, give them a little support, make them feel a little better. Our patients wear these braces all of the time when they're out of bed, and you will notice that these patients do a little bit better with this modality. We also give the patient a little bit of pain medication. These are severe pain. It's breaking a bone, and it's hard to walk around and go about your daily life while breaking a bone. We don't like using pain medication long term, so we want to get this MRI very quickly to figure out what's going on. So here we have his MRIs on the left side here, and here in this middle one we have a T2 image, and this T2 image shows us that there are indeed compression fractures at L1, L3, and L4. But once again, we can't really tell the age of these fractures. And the way we know if it's an acute fracture on a T2 image is it'll be very bright. These all look like they're pretty dark. So maybe they're all old fractures, but then we use the STIR image, and that's what we have over here all the way to the side is our STIR imaging. And once again, we look at L1, L3 here, and L4, and we see where the problem finally is. There's acute fracture at L4. And why is STIR better? Well, it suppresses the fat, really makes that inflammation hyper intense. And that's what we're looking for, is acute inflammation from a fractured bone. So we're able to see this fractured bone here at L4 that's causing his severe pain. We already had him in the brace. The next step for this patient was we went for a kyphoplasty in order to shore up that bone, make sure it's not going to compress any further, and get rid of that pain almost immediately. A kyphoplasty is a procedure that we do right in the office here. It takes us about 20 minutes. We put some bone cement down the pedicle, from the posterior aspect down the pedicle, through a little needle, right into the middle of this bone in order to shore it up. We blow up a balloon to give some of that height back in the vertebral body and also put the cement in afterwards. That cement hardens by the time the patient's off the table. They're doing great. The pain is almost immediately resolved. They might have some post-op pain for about 2 to 5 days afterwards. Once we see them back in the clinic 10 days afterwards, the patient's doing great. They no longer need the brace. They no longer need the pain medication, and they're able to go back about their life.